For more on Hillary's health and all the political ramifications, we're pleased to be joined by our panel. First, Skyping in the former Lieutenant Governor of New York and health policy expert Betsy McCaughey. She joins us from New York. And Skyping in from Los Angeles, political commentator and the son of President Ronald Reagan, Michael Reagan. Michael's also the author of the new book, Lessons My Father Taught Me: The Strength, Integrity, and Faith of Ronald Reagan. It's very interesting when we take a look at what has happened here and we see some of the reaction. For example, this morning on CNBC's Squawk Box, let's look and listen.
Well, I don't take satisfaction, Joe, and frankly, I hope she gets well, and I hope she gets well soon. But it was quite sad, to be honest with you, and I hope she gets well soon.
Betsy, Donald Trump making the rounds, being very diplomatic this morning toward Mrs. Clinton.
As well he should be, and I think that we all share that feeling that we hope Mrs. Clinton gets well. As for the calls for candidates' complete medical histories, I disagree. I think there are already so many disincentives for good people to run for higher office that having to reveal your whole lifetime of medical records is just one more disincentive. I do think it's important for everyone to know the current health status of candidates. It's smart for them to reveal their current medical records, but I disagree that candidates should have to reveal their entire medical history.
Well, what about that, Michael Reagan? Should there be some veil of privacy? I mean, I guess you don't have to know about somebody breaking their arm in the third grade, but in the here and now, there needs to be complete disclosure. Does there not?
The problem is you're asking everybody who would be reading this or listening to it, becoming a doctor and giving their opinion of a medical record. I mean, look at John F. Kennedy. Would he have been a worse president, better president, had we known about Addison's disease? What about Eisenhower? He had, heart attacks while he was actually the president of the United States. What about FDR? Would he have been better or worse if everybody would have known about polio? Listen, how is your health today? And we know how Hillary's health is today. We just witnessed it, over the weekend. I think Donald Trump is doing the right thing by not attacking her on that issue, but wishing her well, as all of us should do.
And yet it may be a kind of an interesting role reversal, because this call for transparency comes from perhaps unlikely quarters. At MSNBC, Morning Joe anchor Mika Brzezinski insisted to a panel that Mrs. Clinton must be transparent about her health issues. Let's look and listen.
The issue is, how much is the campaign going to stumble and lead people down the untrustworthy, lane? Because we need transparency from this candidate. We need press conferences. We need everything to be as transparent as possible, given the legacy, the Clinton legacy.
And that Clinton legacy, Betsy, I'd remind you, not one bit of medical information on former President Clinton back in 1992 when he ran for the Oval Office.
That's right, but I would underscore that it is true we should know about the current health status of our candidates. When I ran for lieutenant governor, I had to get a physical and release it to the Republican Party. They wanted to make sure that I was healthy as their candidate. That's above board. But women particularly do not want to have to reveal their entire medical histories. It's obvious. Things happen in the past. They don't want to have to disclose them forever. So I think that everybody in this discussion agrees that current medical information should be shared, but not medical histories.
Jamie,
Well,
if I could
go ahead. Sure, Michael, go ahead.
This is all brought on by the fact that, they could have done something with this had they announced Friday that, in fact, Hillary Clinton was suffering from pneumonia, but she was going to, in fact, try to get to the memorial services in New York, even though she had pneumonia, make her look like a hero. Instead, they always try to hide things, and they think of it in the political ramification, not in the health ramification. She's being talked about today simply because of the way they handled it.
Well, Dick.
In addition, that it is not the heroic thing to go to a crowded event when you have pneumonia. Mrs. Clinton could be seen shaking hands, picking up babies. Those are things you're not supposed to be doing when you have pneumonia.
Betsy, you know, when you deal with politics, you've got to agree with this. It's perception. That is people's reality. So when I was saying that, I was talking about perception of doing something heroic, no matter what's right or wrong. It is perception because many people vote based on perception, not reality.
And speaking of perception and what the reality may turn out to be, Dick Morris wrote an interesting article for our parent website, Newsmax.com. Dick says that if Hillary needs to drop out, Vice President Biden could answer the call. Dick writing, quote, the Democratic National Committee, 2 from each state, would be empowered to nominate a new presidential candidate. Betsy, would that be Biden or would that be Tim Kaine or somebody else?
Well, that's a very interesting question. I think that in some ways Kaine would be the smartest choice because he would represent on the ballot a lever that says somebody else. That's all anybody knows about him. He's somebody else. And in the current race with 2 candidates who have such high unfavorables, somebody else could really do well.
And what about that, Michael Reagan? Should the Democrats at the top of the ticket bear the mark of Kaine?
Listen, what they're going to do is run polls to see which one could actually win the election. I said a long time ago, conservatives don't want the vice president to jump into this race because there's many conservatives still looking for a place to jump off to, and you don't want to give them the vice president to jump off to. So I would hope that, in fact, that she doesn't drop out of the race. The easiest, the best thing Trump has going for him, he's running against Hillary. The best thing she has going for her, she's running against Trump.
And of course, Betsy McCaughey, Michael Reagan has long maintained that Hillary Clinton and her unlikability may be what carries the day for the Republicans, even with Donald Trump at the top of the ticket. Would you concur?
That's right. It's the unlikables versus the deplorables.
Oh, the unlikables versus the deplorables. And that's something else that we want to talk about with you a little bit later, because before the 9/11 collapse, Hillary on Friday night called the Trump supporters, or half of them at least, deplorables, a basket of deplorables. Listen, we're going to ask you to stay around as we continue here on Newsmax Prime. Dr. Gerard Giannoli will join us later in the program to go more in depth. A doctor taking a closer look at the health implications for Hillary Clinton in her latest health crisis. What more might there be to her condition? We will explore that later. And as we come back from the break, John Zogby will join us to discuss the latest in terms of polls and also make it personal about pneumonia. John wrote a column that appeared today in Forbes that has you thinking pneumonia is not a garden variety type of thing. And of course, Betsy and Michael will be back. You stay with us as well.